You've probably heard this stat. 80% of the world relies on traditional medicine. It gets repeated constantly. Here's the problem. It's not really true. Or rather, it's true the way a rounded-off average is true. The real number swings from around 40% in some countries to 90% in others. Even the WHO has walked the flat number back. We're opening with that because it's a perfect example of today's actual topic. Not which system is better, but where each one actually stands. Precisely, not roughly. Let's be direct about this because a channel that hedges on it isn't being honest with you. For acute emergencies, trauma, heart attacks, strokes, severe infections, conventional medicine is dramatically, unambiguously better equipped. Surgery, precise IV dosing, antibiotics, vaccines. These are among the most successful interventions in human history, full stop. Modern medicine also has an infrastructure advantage: large randomized controlled trials, standardized dosing, and regulatory oversight that catches problems at a scale no individual herbalist tradition ever could. Herbalism's strengths sit in a different place. Chronic, lifestyle-linked conditions, mild digestive discomfort, sleep support, stress management are exactly where herbalism has centuries of accumulated observation and, increasingly, real clinical support. Prevention is another strength. Many traditional practices are dietary and daily, not just reached for once something's already wrong. There's also an access argument that matters more than it gets credit for. Herbal preparations are often cheaper, more available, and more culturally embedded than pharmaceutical alternatives, which is a huge part of why that messy 40 to 90% statistic exists in the first place. It's not backwardness. In a lot of places, it's simply what's actually accessible. Here's the field that proves pick a side is the wrong frame entirely. Pharmacognosy, literally, the study of medicines derived from natural sources. It's a formally recognized branch of pharmacy. The people studying which plant compounds could become the next major drug are not adversaries of herbalists. Often, they're building directly on herbalist and traditional medicine observations. An integrative medicine, clinicians who incorporate herbal and lifestyle approaches alongside conventional treatment, isn't some radical fringe. It's a growing, formally recognized part of many health systems, specifically because the two approaches solve different problems. So how do you actually decide? Here's a simple, non-negotiable starting rule. Anything acute, severe, or rapidly worsening, chest pain, difficulty breathing, high fever in an infant, a serious injury, goes to conventional medical care immediately. No herb, no exception, no, let's try this first. For mild chronic or preventive concerns, occasional digestive upset, general stress support, sleep hygiene, herbalism is often a reasonable first consideration, especially alongside, not instead of, guidance from a clinician who knows your full health picture. And when you're not sure which category something falls into, that uncertainty itself is the answer. Talk to a healthcare provider. That's not a cop-out disclaimer. It's the actual correct move, and you'll hear it constantly through this entire course. Modern medicine and herbalism aren't rivals fighting for one throne. They're two systems with different strengths, and the honest answer to which one is almost always, it depends, and often both. Next lesson, we get inside the actual reasoning process, how a herbalist weighs evidence, tradition, and personal experience when making a real decision. Grab this lesson's workbook page, a quick sorting exercise using 6 real health scenarios. See you in Lesson 4.